Welcome back. According to the Center for Disease Control and Prevention, high cholesterol is a serious health concern that affects more than 94 million adults. It can lead to heart disease, stroke, and possibly even death if left untreated. Joining us now to help you lower your cholesterol are Katherine Wildman, founder and CEO of the Family Heart Foundation, along with Stanford medicine cardiologist, Dr. Abha Khandelwal. Good morning to you, ladies.
Good morning.
Good morning.
So, doctor, let me start with you. What is the current state of cholesterol in America? The numbers seem quite concerning.
You know, over a third of the U.S. population has high cholesterol. Anywhere from 1 in 250 to 1 in 5 have a genetic cause for that cholesterol elevation. And in fact, many individuals cannot treat their high cholesterol with just diet and exercise. Heart disease is the #1 killer of Americans, and we know it disproportionately affects certain minorities. We know if we lower cholesterol, we can reduce that risk. And despite having many medications that can lower cholesterol, only a little over a half of individuals who could benefit are actually on them. So, you know, the current cholesterol health in America needs improvement.
For sure, it sounds like. So let's talk then, as you mentioned medication to reduce cholesterol. Talk about the safety of it and the efficacy.
Yeah, so we actually are in a unique time with lots of medications that can reduce cholesterol. Statins are the cornerstone of therapy that can reduce cholesterol as well as reducing future cardiovascular events. And our current studies show that the risk of side effects are quite low. We also have a newer medication class called PCSK9 inhibitors, and they can reduce the LDL cholesterol to 30 to 40 milligrams per deciliter. And again, recent studies show that the longer that individuals are on these medications, the lower their risk for future heart attack, stroke, and death. So there are a lot of options. You have to talk to your healthcare provider and see. You may need more than one to get to your treatment goal.
It sounds like it. Katherine, I want to bring you in now. This is incredible. Can you tell us what led, as far as you know, to your heart attack? Is it true it was before the age of 40?
Yes, at the age of 39, I was out gardening and suddenly I was experiencing crushing chest pain and pain radiating down my arm. I knew something was wrong. I called 911 and it turns out I had 100% occlusion or blockage of the main artery that is supposed to be feeding my heart blood. But I had known I had high cholesterol since I was 15. What I wasn't told was that I was one of those 1 in 250 people with a genetic cause of high cholesterol called familial hypercholesterolemia, or FH for short. And what's concerning is that most of the individuals in the United States who have this condition don't know it. They know they have a family history of early heart disease. They might know they have high cholesterol, but they don't understand that it could be a genetic driver. And there are other conditions as well like that. But the key is that high cholesterol, regardless of why you have it, really is the driver for atherosclerosis and cardiovascular disease.
Interesting. It's also interesting that you knew at age 15 that you had high cholesterol. So tell us what you think people should know, especially about LDL cholesterol, and what they should be doing to manage it so they can prevent cardiovascular issues.
Well, I think the first step is to understand, empower yourself to know what your LDL cholesterol level is, and then partner with your healthcare provider to make sure you understand your goal based on your risk. It really is true that the data is continuing to mount that the longer you have a low LDL, the longer you're likely to live. And so the new guidance says that if you're like me and you already have cardiovascular disease, your LDL cholesterol should be 55 milligrams per deciliter or lower. So that's new data. We're finding out lower is better.
Wow, and significantly lower too. Thank you so much for joining us, sharing your story. And doctor, thank you for your time today. Really important for us to be managing our cholesterol.
Thank you.
Thank you.
We appreciate your time, both of you. And for more information, I want to share this website. You can visit, it's called morefamiliesmorehearts.org.